Hello everyone, I am Samia Ahmed Khan and I am currently residing in Vadodara, Gujarat. I have recently completed my PhD in pharmaceutics from School of Pharmacy, Devi Ahilya University, Indore. I have done my masters from Jamia Hamdard, New Delhi, and I have cleared my GPAT in 2017 with AIR 441, and I am also a BPharm gold medalist. So this was my introduction, and today I will be teaching the topic Parenterals. So we are going to learn about parenteral preparations today. This is a topic of industrial pharmacy, and it's a very important topic from BPharm point of view and also GPAT point of view. Firstly, let us begin with understanding what are sterile dosage forms. Now, sterile dosage forms are any dosage forms that are free from physical, chemical, and microbial impurities. These are called as sterile dosage forms. Okay, so which dosage forms come under the category of these sterile products? Now, sterile products consist of mainly three types. Firstly, they are parenteral preparations, ophthalmic preparations, which means consisting of the eye. Ophthalmic preparations, since eye is a very sensitive and very delicate organ, the ophthalmic products should be very much pure and sterile. And thirdly, it's the irrigating solutions. Now, what are irrigating solutions? Irrigating solutions are something that are used to clear a particular area or a particular organ. For example, you might have visited a dentist at some point of life or the other. So, one might have noticed that a dentist washes the mouth again and again during a procedure, like for example root canal treatment or cavity filling. So, he or she washes the mouth again and again with a solution. What does this solution consist of? It mainly can comprise of sodium hypochlorite, chloride, or chlorhexidine. These are the main constituents of irrigating solutions, and the solutions have to be very pure and sterile. Okay, now focusing on the topic parenterals. Now, in layman language, if we describe parenterals, it is usually the injections, or it might be the infusions, that is bottle given through the bottle or drip, है ना, जो हमें ग्लूकोज की बॉटल चढ़ती है कभी या आयरन की बॉटल चढ़ती है, तो that is called as infusions. Another term that we must know first is the first line of defense. First line of defense. Now, this is the mechanism of body in which body responds to the external, any external object. Okay, so what consists of the body's first line of defense? Skin. Anything that we administer through skin, it will respond to that. Secondly, saliva, tears, etc. Okay, so these are the very primary and non-specific lines of defense of the body. Now, parenteral preparations, when administered, they pass through the first line of defense of body, that is skin. Okay, since this is the condition of okay, so parenterals, the number one criteria of parenterals has to be that it should be exceptionally sterile or pure and free from contamination. All the components, processes and the areas involved in the manufacturing of parenterals should be sterile. And it follows a very strict guideline that we'll be studying in detail, like what how much filters are used, and how the areas have to be kept clean and sterile during the procedure, and what is the composition of the parenterals. Okay, that we'll be studying in detail in this chapter. Now moving on to the types of parenterals. Firstly, it's the small volume parenterals. Written as SVP. Now the unit dose less than 100 ml comes under the category of SVP. जो हमारे इंजेक्शंस होते हैं उन्हें हम SVP कहेंगे. Secondly, it's the large volume parenterals, written as LVP, having unit dose greater than 100 ml. Okay, जो हमारी ग्लूकोज की बॉटल चढ़ती है ना, ओके, जो इन्फ्यूजन्स होते हैं, that comes under the category of LVP. Thirdly, it's the powder for injection, written as PFI. Now there are many active ingredients that are not stable in the liquid form for a very long time. So that is dispensed, that is given as powders, that come as powders, and during the administration only, that powder will be dispersed into the suitable medium या diluent. अगर वो हाइड्रोफिलिक है तो एक हाइड्रोफिलिक डाइल्यूएंट उसके साथ आएगा. इफ़ इट्स लिपोफिलिक, एक लिपोफिलिक डाइल्यूएंट रहेगा, and it will be dispersed into that and given straight away. Okay, so that is powder for injection. Fourth is concentrated solution. Now concentrated solution also has is first diluted with the suitable diluent, and then it is administered. Okay, and then fifth is suspensions. Now there are many substances that come as suspensions. Okay, they exist in the suspension form, and for example, एक iron injection आपने कभी देखा होगा. Many iron injections, they usually come in the suspension form, and the mechanism of this is controlled drug delivery. So कोई भी सब्सटेंस अगर हमें एक कंट्रोल रिलीज फॉर्म में देना है तो हम उसका एक सस्पेंशन बनाएंगे एंड वील एडमिनिस्टर इट पेरेंटरली. आयरन इंजेक्शन का एक एग्जाम्पल, जैसे हम एक बहुत प्रैक्टिकल एग्जाम्पल देखते हैं, आयरन डेक्स्ट्रान एक बहुत ही कॉमन आयरन इंजेक्शन है, एंड वो सस्पेंशन फॉर्म में एग्जिस्ट करता है. ओके, नाउ द सिक्स्थ वन इज़ द oily injections. They are oily in nature, and that is lipophilic in nature, and उनका mechanism of action जो रहता है, they are absorbed through the process of drug partitioning in the body. Okay, so seventh is the emulsions. Parenteral preparations that are emulsions. They are usually lipophilic drug in a hydrophilic carrier, oil in water emulsions. are given generally parenterally. Okay. Eighth is the sterile solids. This is a very interesting type of parenteral product, usually the lyophilized or freeze-dried products. Freeze-dried products or actives given parenterally. Now, what is lyophilization? Lyophilization is a process in which the liquid dosage form is frozen for a long time to make it a solid one. Okay, the liquid is converted into solid. Now, what advantages does it offer? It is very good in as antifungal. Okay, example of the sterile solid is antifungal injections. They are stable for a very long time and can be reconstituted easily. Okay, so this is all the classification of parenteral preparations. Now, coming to a very important topic of parenterals, that is routes of parenteral preparation. Routes of parenteral preparations. Through which routes parenteral are given? There are various routes through which an injection or an infusion can be given. But firstly, we must understand the physiology of skin. Now, there are several layers of skin. Firstly, it's the epidermis. Then it's the dermis. Then comes the subcutaneous tissue. As we go deeper into the skin. Then again, it's a subcutaneous tissue, adipose. And below that, this is the deepest layer of the skin, okay? And below that, it's muscle and vein. Firstly, coming to the muscle, okay? The deepest one. मसल में इंजेक्शन जो अब हम देते हैं, it is given at an angle of 90 degree. An IV injection is given at an angle of 90 degree. Firstly, studying the IM injection, intramuscular injection. Now, the site. First, learning about the site of IM injection. It's the thighs. Mainly it's called as ventrogluteal muscle. The site where IM injection is given is the ventrogluteal muscle. And ये एक GPAT का क्वेश्चन भी है कि ये ventrogluteal muscle जो है, which of the following sites is in IM injection site. तो उसके ऑप्शंस में बहुत सारे थे and ventrogluteal muscle was the right answer for the question. और दूसरा एक और चीज़ है अपर आर्म्स में भी दिया जा सकता है. ओके, सो इंट्रामस्कुलर बिल्कुल डीप डेप्थ में जाता है, 90 डिग्री के एंगल में इंजेक्शन देते हैं एंड द साइट इज़ वेंट्रोग्लूटियल मसल एंड अपर आर्म्स. नाउ व्हाट आर द एग्जाम्पल्स ऑफ IM इंजेक्शंस? बीइंग अ फार्मासिस्ट, हमें practically we must know the examples of IM injection, examples of every injection of course. So the allergy medications जो हैं वो IM administer होते हैं. Hormone injections, the flu shots in babies. अगर if you've seen a baby getting a flu vaccine, it is usually IM injection. एंड अनदर वन इज़ बोटॉक्स. देखो ये एक्ट्रेसेस में बहुत कॉमन है. द बोटॉक्स इंजेक्शंस बहुत लगवाती हैं एक्ट्रेसेस. इट्स वेरी मच इन ट्रेंड. सो आप उससे याद रख सकते हो कि बोटॉक्स इज़ एन आई इंजेक्शन. नाउ सेकेंडली comes the subcutaneous route, that is SC route. Now SC route का injection, it's usually given when we need slowest absorption of the drug. Slowest absorption of the drug because it's given in the subcutaneous. Subcutaneous से हमें पता चल रहा है that it is given in the subcutaneous layer of the skin, which is the deepest layer of the skin. Okay, now what is the site of SC injection? It's of course lower abdomen and upper area of buttocks. Okay. इसका सबसे कॉमन एग्जाम्पल है एंड अ वेरी इंपॉर्टेंट एग्जाम्पल इज इंसुलिन. द इंसुलिन इंजेक्शन इज़ एन SC इंजेक्शन. ये एक बहुत ही इम्पॉर्टेंट क्वेश्चन रह चुका है. इट विल ऑल्सो बी it is asked many times during B.Pharm semester exams also. So insulin is a subcutaneous injection. Okay, हमने देखा ये that it is administered in the lower abdomen. Okay, so the next example is blood thinners, that is anticoagulants used to dilute the blood. So parenterally इसका एग्जाम्पल हम याद कर सकते हैं, दैट इज़ वारफरिन इज़ अ वेरी कॉमन एग्जाम्पल जो कि ब्लड क्लॉट्स डिज़ोल्व करने में यूज़ होता है. सो इट इज़ गिवन इन बाय द SC रूट. ओके, अच्छा, वन थिंग ऑल्सो दैट द SC रूट here it is. So it is given at a 45 degree angle, like 45 degree angle here. It is given 45 degree at an angle. The injection is given at a 45 degree angle. If it is intradermal, it is given at an angle of 10 to 15 degree. And if it's intravenous, okay, intravenous is somewhere here in the dermis, in the dermis here. So it is given at an angle of around 25 degree. This is intravenous. Okay, so intramuscular 90 degree, subcutaneous 45 degree, intravenous somewhere here are the veins, okay, that is 25 degree, and ID it is intradermal 10 to 15 degree here, just here in the dermis, epidermis. Okay, so thirdly we have come here, thirdly it's the intravenous route. We have come to the intravenous route. Now we have already studied that intravenous route, it is given at a 25 degree angle. Now what are the sites of intravenous route? It's mainly जो हमें बॉटल चढ़ती रहती है, कभी ना कभी ग्लूकोज की बॉटल चढ़ी ही होगी, तो वी नो दैट इट इज़ यूजुअली गिवन इन द फोर आर्म एंड बैक ऑफ द हैंड. ठीक है, दिस इज़ वेरी कॉमन, तो हम इससे रिलेट कर सकते हैं. एंड जस्ट हमें ग्लूकोज की बॉटल चढ़ती है एंड वी फील वेरी गुड, तो ऑफ कोर्स थ्रू दिस वी नो कि उसका बहुत ही फास्टर एब्जॉर्प्शन होता है ड्रग का. जब हमें एक इमीडिएट इफेक्ट चाहिए होता है, वी एडमिनिस्टर इट थ्रू द IV रूट. नाउ एक इसका में एक GPAT का क्वेश्चन फॉर्म होता है. एक इम्पॉर्टेंट साइट है एंटीक्यूबॉइटल फोसा. बेसिकली ये इस एल्बो जॉइंट को हम एंटीक्यूबॉइटल फोसा कहते हैं. एंड एल्बो जॉइंट को एंटीक्यूबॉइटल फोसा वी से, and this is actually the IV route. So the question that forms in the GPAT is identify the site of IV route. There will be various options and one of them would be antecubital fossa, which is basically nothing but the elbow joint. So this will be the right answer for that. Fourth comes the intradermal route. Intradermal route, as we have studied now, that it is given ID route at a degree of 10 to 15 degree. What are the sites of ID? It's usually upper back around the shoulders. Okay, upper back around the shoulders, and inside of forearm. And example of this is TB vaccine. TB vaccine is an example of ID route of parenterals. So this was my video for the topic parenterals, and it's a very important topic in the B.Pharm as well as from GPAT point of view. So I hope you like this video. Thank you.